Hi, my name is Karen Bray. I'm the Vice President of Optima Health for Clinical Care Services, and I'm here today to talk to you about diabetes, being able to understand it and manage it, as well as something called prediabetes, which is the condition that usually precedes diabetes. So this is a passion of mine. We're going to talk about these things today. So the first thing you need to do when you're thinking about diabetes is to understand what it is. Lots of people believe that diabetes is a disease of sugar consumption. And so when they find out that they have it or that a family member has it, they think that it means that they can't eat any more sugar. It's far more complicated than that. So as you can see, diabetes actually is a disease of the pancreas, which is an organ that sits behind your stomach, and its job is to make insulin. It's a complex disease, and it has to do with how your body uses fuel. So if you think about it from the perspective of your car uses gas, your body uses sugar to do its job every day. What the pancreas does is it creates a hormone called insulin, and insulin has to bind with sugar in order to allow your cells and your muscles and your brain and all the parts of your body to work adequately. So the important part to remember about diabetes is that while it is about sugar, it doesn't really have anything to do with sugar consumption. So how the body functions without diabetes when the body is functioning normally is you have a normal cell, and this slide depicts the keys as being insulin. So sugar is something that we either eat or our body turns most of our food into sugar. And when we ingest it, sugar binds with insulin and gets into the cell and allows the cell to do its job. What happens when you have diabetes is you either have type 1 diabetes or type 2 diabetes. Type 1 diabetes is the smaller amount of diabetes. Only about 5% of people actually have type 1 diabetes. It's also known as juvenile diabetes, and it tends to happen early in life. Type 2 diabetes is almost the exact opposite. We acquire it over time, and it tends to be related to the aging process, having to do with weight gain, having to do with lack of exercise, a lot of different things. 95% of people who have diabetes have type 2 diabetes. Type 1 diabetes means that insulin is not being created within the pancreas. So the pancreas is essentially broken, and it's not able to create insulin. So you have to replace insulin with injected insulin or using insulin through needles and syringes, and you're probably familiar with that process. In type 2 diabetes, a totally different problem exists. Your body's probably making plenty of insulin. It's just that the insulin that it makes is not necessarily good insulin. So either your body is resisting the insulin that you have, or it is making inadequate or poorly designed insulin. Either way, insulin isn't there to move sugar into the cell, and that means that your body isn't going to work appropriately. So if you find out you have diabetes, what are you going to do about it? Lots of people associate, as I said before, the idea of having diabetes with a sugar problem. And so most people who find out that they have diabetes feel like what they need to do is stop eating sugar. They cut candy bars out, they cut cake and cookies, they generally tend to cut carbohydrates, which means bread, to most people. And so what happens is that's not an eating style that is generally sustainable. And most people who try to cut things out of their diet that they enjoy find that sooner or later they break that habit, they're not able to sustain it, and then they feel guilty about it. And we'll talk about the feelings of guilt that you have with diabetes in a few minutes. But from an eating perspective, the most important thing you can do is to follow a healthy diet. And a healthy diet means that you're going to ingest lots of different kinds of foods. You're going to have proteins, you're going to have fats, you're going to have carbohydrates. But the issue for most of us, especially in the United States, is that we eat just too much food. Our portion sizes are inaccurate. So for example, the size of an apple or a piece of fruit that you eat should be about the size of your clenched fist. If you look in the grocery store these days, you'll find that most of the fruit that we eat, an apple for example, would be much bigger than that. So you have to take into consideration the amount of food that you're actually eating. If you have 2 servings of rice or potatoes, that's probably going to have an effect on your diabetes, because all foods, to some extent, turn into sugar in your system to allow you to use it for energy. So the first thing to think about when you think about food is to look at your portion sizes. Start to get a sense of what you should be eating. So an apple or a piece of fruit should be about the size of a fist. A serving of potatoes or vegetables like corn or lima beans that are very starchy should be what fits into the size to your cupped palm. And then when you think about food or about meat, it should be the size of your palm together. So men have bigger palms, they're going to get a little more meat than a smaller woman, but you really need to think in terms of portion size when you're talking about food ingestion and taking good care of your diabetes. One of the things that people believe about diabetes is that they can't have any sugar. That is not true. And in fact, most people who try to cut sugar out of their diet are setting themselves up for failure. It's impossible to do, first of all, and you start to feel like you're not getting some of the things that you really want. You'll find yourself locked in the bathroom with a Sara Lee cheesecake, and that's not really what we're looking for here. We're looking for a sustainable, nutritious diet. And the other important thing to remember is that that's the right diet for the whole family. So if you happen to be the cook of the family, you don't need to cook something different for you to take care of your diabetes than what should be fed to your children and your spouse and your other family members, because a diabetic diet is actually the best diet for everyone. So let's talk a little bit about being active. So diabetes, in order to control it, a couple of things you really need to do. You need to make sure you eat right. You need to make sure you exercise. Probably your doctor has told you that. Again, eat right and exercise are simple words, but they're more complex processes. So when we talk about exercise, people start to think that means that I have to join a gym, it means I have to walk 5 miles a day, it means I have to work out with weights. It makes it very complicated when you think of exercise in those terms. The truth of the matter is that in order to have a good activity pattern, the first thing to do is to figure out, what do you like to do? Do you like to walk? Do you like to play tennis? Do you like to swim? We're fortunate in this area that we have lots of bodies of water that facilitate something like that. We want to think, first of all, about what the activity things are that we can do that we enjoy doing. Secondly, you want to be careful that at the end of a busy day, you don't believe that sitting on the couch for the next 5 hours and watching television is a good way to relax. It isn't. It actually creates a different problem for you, even if you don't have diabetes. So one of the things to remember about activity, though, is that if you break it into multiple 10-minute sessions, so 30 minutes a day is about what you should be getting. Think in terms of what you are getting. You can break that 30 minutes a day into 3 10-minute cycles, or you can take a walk for 30 minutes, walk your dog, take a walk with your children, take a walk with family members. Get started, because lots of people believe that from an activity perspective, they have to do something very complex and different than what they've done before. The important thing is to start somewhere and to do what you need to do. From an exercise perspective, it doesn't need to be necessarily cardio or resistance training, although both of those things are good. But you don't need to join a gym to do those things. Cardio is walking. Lots of people believe that the best exercise is exercise that when you are doing it, you can't carry on a conversation. And that is inaccurate. In fact, if you can't carry on a conversation, if you're fighting for oxygen, you're working out too hard. So you probably need to back off just a little bit. And then from a resistance training perspective, you don't have to go out and buy expensive weights. You can get yourself a simple elastic band and use it to pull on your arms, pull on your legs, move your body through a variety of different exercises to make sure that your muscles and your tendons and your vessels are working hard as they should be. Monitoring for diabetes, we're talking now about blood glucose monitoring. And I don't know what your doctor may have told you about blood glucose monitoring, or maybe your doctor didn't mention it at all, or maybe you've been told that you don't really need to do it. All of those things might well be true. If you're using insulin, it's probably a good idea to test your blood sugar periodically. But the truth is, if you're sticking your finger and either recording it in a book or leaving it on your meter, but you're not doing anything with those numbers, then you're really kind of wasting your time. So let's talk about how you should use those numbers when you decide that you're going to test your diabetes and do blood glucose monitoring. So the first thing to do is to get a blood glucose monitor. Now, if you are covered by Optima Health through Centera, then that is a free service to you. You will get your blood glucose monitor for nothing. If you go through your pharmacy benefit, it is possible that you won't pay anything for your strips as well. So you need to understand what your benefit package is, and you can do that by calling Optima's benefit number, which is on the back of your Optima card. Or if you have a different type of insurance, call them. Most insurance companies make it pretty easy to get diabetes test strips. Once you have the strips, you need to think in terms of when you're going to monitor your blood glucose. Usually what I tell people is you should monitor 2 times a day, 2 or 3 times a week. And the times of day should be like this. On the first day, you test first thing in the morning when you get up, before you eat breakfast. Let's see what your blood glucose is at that point. Then pick your next meal, which if you're doing it on the first day, would be breakfast, and test it 2 hours after breakfast. This is going to tell you 2 things. That first reading that you're taking when you are fasting overnight is going to tell us whether or not your pancreas and your liver are working well together. So that number should be shared with your doctor or with a diabetes educator, or if one of the case managers over at Optima Health. The second number is telling you what the composition of that meal was. So if 2 hours after you eat that meal, your blood sugar is higher than 150, you probably consumed too much food on that meal, or it was a poor organization of the meal and you had too many of one kind of nutrient rather than another. So your second reading is going to be on another day of the week. Test it not in the morning, but test it after lunch. Test it after dinner. A couple times a week you need to do that. That'll save your fingers. So lots of people think they're supposed to test every morning when they get up. That's not necessary. So a few times a week is good for blood glucose testing. Talk to your doctor about your results, or talk to a diabetes educator, one of the case managers over at Optima. Those are people who can help you to interpret the results and understand what they mean. But again, if you're going to test your blood glucose, you want to be doing something with those numbers, not just recording them somewhere and then making no changes to either your diet or your exercise or the types of medications that you might be taking. The American Diabetes Association also recommends that you have something called an A1C test, and you should have that probably twice a year if you have diabetes. Your doctor will be able to order that test for you, and they'll set a range for you of where you should be with your A1C. Typically, we like to see most adults having an A1C under 7%. For some people, especially older people or people who have other kinds of comorbid conditions, we generally say under 8%. But your doctor can help you with that. Twice a year, you should be having an A1C test. So now we're going to talk about taking medication. The biggest mistake that people take with diabetes when it comes to medication is that they stop taking it. They think that it causes some kind of a problem, upsets my stomach, I don't remember to take it, I don't like to take it, I don't think I'm really that sick and I don't need to take it. And those are all the kinds of excuses that I hear people say. The first thing is that if you have a problem with the medication that you've been prescribed and you don't want to take it, you need to talk to your doctor. Diabetes is a pretty nasty disease, and we'll talk about that in a few minutes. But taking your medication is one of the most important things you can do to manage your diabetes. Now, typically when you first learn that you have diabetes, unless you're type 1 patients always have to go on insulin right away. But if you're type 2, you'll probably be on an oral medication for a while. That oral medication should be evaluated against that A1C blood test that you're going to be taking. Because if the medication becomes less effective or isn't working as well, a change might have to happen to your diabetes. The important thing to remember is that diabetes is a lifelong disease. It's never going to go away. So even if you get it under control, it's still there, and you probably will continue to need to take something. Even if you do a really good job taking care of it and can get off medication for a while, there's a chance that you will have to go back on medication at some point in the future. That is not a failure on your part. It is just the nature of this disease. So from a medication perspective, you want to ask your doctor or your pharmacist or your nurse practitioner to help you make the best choice about which medication you should take. You should be evaluating that A1C to make sure that the medication is working effectively. You can use home blood glucose monitoring if you're going to use the numbers to make changes or to talk to your doctor about the results that you're getting. There are some over-the-counter products, so you need to make sure that your doctor knows if you're taking nutraceuticals or vitamins or some other substance over the counter, because some of those things can actually affect the level of control that you have with your diabetes. Lots of people avoid insulin, and they avoid it a great deal. So often what happens is that somebody goes back to see their doctor after having managed their diabetes for many years, and the doctor will say, you know, your blood sugars are starting to change. They're getting a little more out of control. I think it might be time for you to go on insulin or one of the other injectables that are on the market today. Oftentimes a patient response to that is, oh no doc, I haven't been eating right, I haven't been exercising, I'm going to go do that, and so let's not put me on insulin yet. It's important to remember that if you have attempted to do those things, to eat right and to exercising, you're doing what you think is the most reasonable job that you can, then probably it is time to start to switch over to insulin. Insulin doesn't mean that your diabetes has gotten worse. Lots of people, one of the problems with diabetes is that it runs in families. So many people make the assumption that once they're told to go on insulin, their diabetes has gotten worse. They've seen family members, for example, who have perhaps lost a leg or started to have some real serious problems related to diabetes. And it happened about the same time they went on insulin. So people make that connection. Truthfully, what happens is that most people don't go on insulin early enough. And by the time they do, putting that insulin back into the body through an injectable form is less likely to be able to control the diabetes. So if your doctor recommends that, really think it through before you decide that you think that's a bad idea. One of the important things to remember about injectables, insulin or other injectables for diabetes, is that the needles are incredibly tiny. They are much smaller than they used to be. In fact, most people tell me that a finger stick hurts worse than an injection of insulin, even if you're putting it in the abdomen, which is the recommended place to put it. And sometimes that scares people. So again, if your doctor tells you that that's what you need to do, you have resources. Talk to a diabetes educator, call Optima and talk to one of the case managers, talk to your doctor, talk to your nurse practitioner. They can help you to get over the rough spot of doing something difficult that you're just a little bit afraid of initially. But insulin is a very good drug and manages diabetes well. Coping with diabetes. So I mentioned that diabetes is a lifelong disease. It isn't going to go away. No matter how well you manage it, it's still there. Your pancreas still isn't working the way that it should, and that's not going to change. You may be able to control it. You may be able to control it for a long time, but you still have diabetes. It doesn't go away. So the idea of having a chronic condition that isn't going to go away is a very difficult thing for people to deal with emotionally and from a coping perspective. Oftentimes, about 40% of people with diabetes find that they also suffer from a certain amount of depression or anxiety that's related just to the idea of having a chronic illness and having something that you have to think about, food portions and exercise and whether I should be testing every day. So in order to manage that best, there are some things that you can do. Coping functions can help a lot. Taking your mind away on a vacation, imagining yourself at the beach, reading a good book. It really depends on the person, but everybody has things that make them feel better. We have lots of people around here who tell me, I just go out and fish for a few hours and that makes me feel better. Or I take a walk, or I go see a movie. So there's no right answer, but it is important to remember that because diabetes is a chronic condition and it does tend to wear you down over time, it's important to think of it from the terms of healthy coping. So some of the things that you can do is to not worry too much about what other people tell you about diabetes. Now, oftentimes, well-meaning people will give us advice about chronic conditions. This didn't work for me, that didn't work for my brother. Make sure that you keep that conversation with your physician, with your diabetes educator, with somebody who really understands your condition, because diabetes affects people differently, and you want to make sure that you're not taking into consideration something that's different about the way someone else treated diabetes. It is also true, though, that sharing things like a chronic illness and your struggle to deal with it is an important thing that helps other people to help you. So within a family, if you're struggling with diabetes and you're not the cook, make sure that the cook understands what needs to be done in the family to make sure that the right foods are presented at meal times, that you're thinking in terms of amounts of foods to eat. I've seen families where the mark of a good meal was that people overeat at the meal. And sometimes it takes an honest opportunity to sit down with people and say, you know what? I have a chronic illness. I'm going to eat a portion that might look smaller to you. Doesn't mean I don't like the food. It just means that I have to be more careful about how I use my nutrients. So those are some of the things that you can do to cope with your diabetes. Another issue is reducing risks. So diabetes is a really nasty disease, and one of the reasons why I've always been intrigued by it is that it doesn't get the kind of the press that cancer gets or heart attacks get. Those are scary conditions. People are naturally afraid when they get those kinds of problems. They tend to treat those things more seriously. Diabetes, because it's so ubiquitous, so many people have diabetes, tends to be downplayed in many ways. People say, I have a touch of sugar, or my doctor says I just have to be a little careful with my sugar intake. If that's happening and you have diabetes, you want to make sure that you think in terms of what the risk factors are. So diabetes actually is the third disease in what is a common triad of diseases. Oftentimes people get high blood fats or high cholesterol first. Then they tend to get high blood pressure second, and then they tend to go on to have diabetes. So oftentimes by the time you get diabetes, you also have those other two conditions. Those three things together can be a real problem for your overall health and longevity. So it's important to think in terms of making sure that you try to reduce your risk factors by taking care of all of those things. You'll probably be on a cholesterol medication. You'll probably be on a blood pressure medication. You might be on more than one. And you'll probably be on a diabetes medication. So now you have to juggle a lot of different things all at the same time. Taking a lot of different medications can be overwhelming to people sometimes. Don't stop taking something because you think it's not working, or it has a side effect that you don't like, or you just don't feel like you should be taking all those pills. Make sure you talk to your doctor about those things and about spacing medications to make it easier for you to get them in every day. It is important to note that diabetes is the #1 cause of heart disease. So for many people who have been hospitalized with heart attacks or clogged vessels, diabetes is actually at the root of those things. It is a significant cause of strokes. So it's important to keep thinking about the things that diabetes can cause downstream. It's the #1 cause of blindness of adults in the United States. It's the #1 cause of limb loss. It is the #1 cause of end-stage renal disease, which causes people to end up on dialysis. So it is a pretty brutal disease, and it's important to take honestly good care of it and to understand it very well and the way your body is reacting to it. Problem solving. So what do you do when your body does something strange as far as your diabetes is concerned? What if you start to have low blood glucose situations where you start to feel shaky, sweaty, dizzy, and not feeling so good? And this can happen to people who are on insulin and even some of the pill forms of medications for diabetes. So you need to be able to understand what problems you're facing and how you're going to solve those problems. For example, skipping meals is a very bad idea for people with diabetes. It almost sounds counterintuitive. Lots of times people think, well, if I have a problem with excess blood sugar, then maybe if I just skip breakfast every day, it will help with that. People with diabetes should never go for longer than 5 hours without eating something, because the delicate balance that goes on between the pancreas and the liver in your system will be thrown off by long periods of fasting, and that will cause your diabetes to get into poorer control. So from the perspective of problem solving, when you get sick, for example, I get a bad cold, I get the flu, I don't feel like eating, my stomach is upset and I don't want to eat. It's very important to make sure that you take small amounts of some kind of food, something along the lines of Jell-O or a pudding or something that is fairly easily digestible. People take broths or chicken noodle soup. which, that's what your grandmother told you about 100 years ago. Chicken noodle soup is a pretty good thing to take when you're not feeling well, and it'll make sure that your body continues to have the nutrients that it needs in order to manage an illness of some kind. Another thing we should talk about when we talk about problem solving is alcohol consumption. So lots of people don't recognize that while alcohol has calories, and it does, they think that if I'm going to consume an alcoholic beverage and I have diabetes, then probably I shouldn't eat anything because that will add more calories to my system. And that is wrong. That's counterintuitive. So if you're going to have beer or a glass of wine, you can enjoy that. There is nothing that you can't do with diabetes as long as you do it in moderation. But if you're going to do that, make sure you have it with a handful of pretzels or a small sandwich or some other kind of a snack, because alcohol tends to lower your blood sugar. So if you have diabetes and you ingest alcohol, it's going to lower your blood sugar. Make sure you also eat a snack with that, and that's the way to avoid that becoming a problem. I'm going to switch gears a little bit at this point, and we're going to stop talking about diabetes itself as a disease process, and we're going to talk about, are you at risk for diabetes? Did you know that in the United States and America right now, 1 in every 3 adults is at risk for developing diabetes? In fact, diabetes has become an international epidemic. We talk about the flu, we talk about other kinds of scary epidemics. Diabetes is a full-blown epidemic in both the United States and across the globe. So it's important to understand, are you on a path to developing diabetes? Are you at risk for developing type 2 diabetes? There is a test that you can take to determine that. And quite frankly, because 1 in 3 adults is at risk for getting diabetes, you could be one of those 1 in 3. The test actually asks some very simple questions. So it is a 7-question test, pretty easy to take. How old are you? And of course, as you get older, and this is just unfortunate, our bodies tend to wear out a little bit. Well, that's true for your pancreas too. So as you get older, you become more likely to have a risk for getting type 2 diabetes. The second question is, are you a man or a woman? Now that doesn't seem fair, but lots of times life isn't fair. If you are a man, you are a little more at risk for getting diabetes than if you are a woman, especially depending on how old you are, because estrogen tends to be a little bit protective of some of the common chronic diseases. If you're a woman, though, have you ever been diagnosed with gestational diabetes, or did you ever have a baby that was over 10 pounds? And if you were diagnosed with gestational diabetes, then you get an extra point for that, because that puts you at risk for developing diabetes within 5 years after that gestational birth occurs. Do you have a mother or a father or a sister or a brother, a primary relative with diabetes? That will also get you a point. Have you ever been diagnosed with high blood pressure? High blood pressure, as I said before, can be a precursor to developing diabetes. Are you physically active? And be honest with yourself about this. This isn't a test that you're getting graded on. This is something that you're going to take to help you with your health. So be honest about how physically active you are. You've probably heard people say that sitting is the new smoking, and I think in many ways that's true. So be honest as to whether or not you truly are physically active. And then what is your weight category? And on the right-hand side of the diabetes test, there's a chart that shows you the BMI, or the body mass index. Now, lots of people throw sticks and stones at the body mass index, frankly, and they say, well, if my body is mostly composed of muscle is heavier than fat, and that's all true. But again, you're taking this test yourself, you're alone. Be honest with yourself about how much muscle versus fat you probably have. If you scored 5 or higher on that test, you are at risk for developing diabetes. So the good news about finding out that you might be at risk for diabetes is that there are solutions to this problem. In fact, most employers have relationships now with groups that help you manage pre-diabetes. That's what this is called, pre-diabetes, or being at risk for diabetes. So one of the things that you can do always is look on your health insurance card, call the number for customer service on the back, and find out what resources are available to you. But there are good diabetes prevention programs, and actually they do all the things that we've just talked about. They have to do with helping you to develop a better nutrition plan, helping you to manage your activities well, remembering to take your medications, and being honest with your healthcare provider if you don't like them or you don't feel like you can take them correctly. The advantage of a good diabetes prevention program is also that it tends to be a group format program. So you're in a group with people who have the same problem you do. As much as you can learn from a healthcare provider, you can learn almost as much, and sometimes even more, from being with other people who have the same disease that you do. So joining a diabetes prevention program, and there are numerous ones out there. Again, your health insurance company probably has one. They'll be happy to share that information with you. You can go to your website at your place of employment. They probably have information about that as well. The YMCAs in this region generally have good courses for diabetes prevention. And what the data have shown, and this is one of the situations where data truly does drive the outcome here. The data have shown that if you can lose 7% of your body weight, now you do the math on that, but that's not a lot of pounds. So generally, people recognize that weight loss in diabetes management is one way to control the disease, and it's one way to stave off the likelihood of developing the disease at all. 7% of a body weight loss is enough to prevent you from getting diabetes for a 5 to 7 year period. That's really good news, because most of us can manage to do that and manage to make the changes that are kind of put together in your life so that you can maintain them and sustain them, and therefore change your behavior pattern. That's what this is really all about, is changing your behavior. So I hope that this has been helpful for you today. I hope it helps to answer some questions. If you have more questions, you also have resources. Your physician is always happy to help. Your health plan is always happy to answer questions. A diabetes educator, and there are many diabetes educators in this community. You can go to the diabetes.org site and look up somebody that you can talk to in your area. Again, it's important to learn the things that you need to do to make the changes in your behavior as you move through the course of diabetes, and I know you can do this. So good luck. Please feel free to contact Optima if we can help you with this, and thank you for your attention today.